I'm now joined by Chris Biggs, and we're talking today about a very common problem, and that's neck problems. And we're seeing a different side of Frank here. Can you tell us exactly what people will notice if they've got neck problems?
Sure. So the problems that manifest the neck kind of depend on what part of the neck it's originating from. Commonly, upper neck problems can manifest in pain over the back of the skull, a certain type of headache. At the bottom of the neck, it's more what people call broad tension across the tops of the shoulders.
And what could cause those problems?
A very common one that's cropping up a lot in the clinic these days is a patient will wander in and say they've slept funny. Now, the major faults in sleeping positions, first of all, you should never sleep on your front. It's a horrendous idea, it creates the most amount of problems. But mostly sleeping on the side, it's a position of the middle back relative to the neck, and it's to do with the amount of rotation that's involved. And it just creates all kinds of pressures in your neck and your middle back that shouldn't exist.
And what about using social media and being on computers? We hear a lot about that these days.
There's an interesting one cropping up that I colloquially call iPad syndrome, and that's someone sitting in an armchair with a neck craned, staring at an electronic device for 2 hours straight without a break.
So there's a lot of different things that can cause it. What can you do as a chiropractor to help?
Find out exactly what the postural faults or the behaviours are that are incorrect, diagnose the joints that require a bit of treatment, and turn around and do something active to get you back and keep you moving.
Perfect, Chris, thank you very much indeed. And if you'd like to find out more about how Swindon Chiropractic can keep you moving, click on the button below.